Welcome and thank you for joining us for today's Lunch and Learn session for Allied Health, working with multicultural communities, TIS, disabilities, and NDIS. My name is Sydney Cruikshank and I'm from the PHN education team. Before we begin, I'd like to acknowledge the traditional custodians of the land that we live and work on. For me on the Central Coast, that's Darkinjung land. And I'd also like to pay respect to elders past, present, and emerging. We're joined today by Kristen Barker, who is the practice manager of Armidale Podiatry, as well as Matthew Teese, who is the Multicultural Services Officer for Services Australia, and my colleague Ellen, who is an Integrated Health Officer with the PHN. A few things to let you know about this session. It will be recorded and available for you to view in our education library in a few days' time. As attendees, your camera and microphone are automatically disabled. However, if you have any questions, please find the question box located within your control panel, and we will go through these at the end of the session. An evaluation will also come to you directly after this session ends. Your feedback is extremely important to us as it enables us to do future education. Now it is my great pleasure to introduce Kristen, Matthew, and Ellen.
Thank you so much, Sydney. So my name's Ellen. I'm an Integrated Healthcare Officer here in Armidale, and I work with the multicultural community here. So I just want to give you a few little points that come up all the time with doctors, and just to clarify a few things. So a lot of people are confused between Settlement Services International and Mosaic, what their roles are. So Settlement Services International look after the refugees when they first arrive. They look after them for about 12 months. Now they only are funded to do probably about 6 or 7 visits, and visits include real estate agents, schools, hospital, things like that. So we need to work out ways using interpreters of how we can book future appointments with allied health professionals, and so we do that through TIS. I'll let Kristen go into that further. Once the 12 months is up, then Mosaic take over looking after the refugees. Now they're not as involved, they get funded for less things, but by that stage the refugees are more standing on their feet. So, so if anyone needs any clarification on SSI and Mosaic, just contact me after the webinar and I can give you more information. So just regarding the lack of GPs, the loss of 7 GPs here in Armidale, we have responded, the LHD, with a response to that. They've put a specialist in place in the hospital who's working 2 days a week. So he's working just with the refugees. So that's to take the pressure off of general practice at the moment, and that's in place for the next 6 months. So the refugee nurses, we now have 2 of them, and they're based at the hospital, and we still have the care navigator, which works from Healthwise. So the care navigator will link between the hospital, the refugee nurses, and the GP practices. The only thing I would say about the TIS, which Kristen will go into, your access now to Chris, is you will find that the Yazidi refugees will ask for a language. If you say, what language do you need, they'll say Yazidi. Yazidi is not recognised yet as a language, so you need to actually book a Kurdish Kamanji, preferably with a northern dialect at this stage. But there are moves afoot to make Yazidi a recognised language within TIS, but at the moment it's not. So we just need to clarify that and stick with Kurdish Kamanji, and as soon as we've got Yazidi recognised, we'll then have Yazidi interpreters. So I'll hand over now to, which one's going first? To Kirsten.
Hi, hello, my name is Kristen Barker. I'm the practice manager at Armidale Podiatry. Before I continue, I would like to also acknowledge the traditional landholders of the country on which we meet today, the Anawan people. It is unceded land, always was, always will be. So basically, what I want to show you today is how to register your agency to get onto TIS. I'm sure I don't need to explain to you the benefit of speaking the same language as your patient, but maybe I will anyway. Obviously, you need to be able to speak with your patient for clinical purposes, but also for emotional purposes. And we are finding that a lot of our patients who come in as refugees are needing that extra support. A lot of what they're going to tell you is quite traumatic, and you do need to work closely with both them and the interpreter to make sure that you get the full story. There's a lot of shame around a lot of the things that have happened to them, although we know that there shouldn't be. Trauma permeates itself in different ways. And so these interpreters are trained in assisting them to tell their story and give you as much of the information as you need. So I'm going to go ahead and share my screen. Hopefully that works. If it doesn't, we've got beautiful Sydney on the line ready to help us out. And basically, you just go straight to tisnational.gov.au. You can see we've got a lovely website here full of lovely people all along. And I go over to register agency. Now you can see on this page that there is a fee-paying service and there is a free service as well. What we want to do is figure out if you're eligible for the free interpreting service or not. Medical practitioners can, and what we're looking at today obviously is allied health professionals. Now this is something really new and I'm personally very excited about it, which tells you a lot about what's going on in my life at the moment, because some allied health professionals have been approved for free interpreting services. This is going to make a huge difference for our patients, for our practices and everybody. You can find out if you're eligible for the free service by jumping on to here. So basically, you say where you are, we're allied health professionals, and then we look at our LGAs, which is, I'm sorry, I should have brought this page up earlier. I thought I had it all together, but again, that tells you a lot about where my life is at the moment. It's not. You can go here and look at your determination. And it gives you all the different jurisdictions. This is me here in Armidale, so I know I'm good to go. So what I want to do is complete an online application form. Excuse me, we do double up a little bit here. So what we can do is very quickly go through step by step, because you have to do it in two parts. You have to register for your client number and then you register your practice as a whole. So it's very follow your nose. So type in things like that. You've got your APRA number. I've got my podiatrist Trinidad's APRA number here, but I won't pop it in because I know I'll make a mistake. You've got your supporting documentation, which is usually just some sort of APRA accreditation or certification. Click, click, click. All of this is very, very easy, I promise. This is where you can say yes, no, not sure. If you don't have a code, it's very easy to get one, and we'll go through that in a moment as well. We all read our terms and conditions always. I know we do. We all say yes, and then we confirm, and it really is as simple as that. You fill in all the details, which you probably do 10 times a day for many other things, and then they'll put you on the list and you should get your receipt or response within that 20-day period. If you don't already have your client code, there is a special button that is hidden behind my screen at the moment. Apologies. Would you believe that I practiced this morning and I didn't have any of these issues at all? You'll have to forgive me, I can't seem to bring it up at the moment, but I promise it is easy. As long as you're not on the spot doing a live webinar, you'll be able to find it perfectly, I guarantee you. Before we go on, does anyone have any questions at all? All right, I think that might be me done if I can't get onto the client code. Ellen, would you say that that's, is there anything else that you'd like me to cover?
Yeah, no, that's, if everyone's clear on that, that's great.
I think so. I can't see anything dinging at me, so I hope we're all good to go. Thank you very, very much for your time. I will pass over to Matt and I'll be here for the rest of the session in case there are any questions.
No questions. Thanks, Kristen.
Thanks, Kristen. Hi, everyone. My name's Matt Teese. I work as a Multicultural Services Officer with Services Australia, also known as Centrelink and Medicare. I'm based in Armidale. I cover quite a wide footprint, which takes in Tamworth, Gunnedah, Inverell and Glen Innes. So a special thanks to Ellen and the Primary Health Network for the opportunity to talk with you. Today I'll be providing you with information about how I support our culturally and linguistically diverse customers, or CALP customers. Whilst my role is more community facing, I do provide assistance to clients who may need further help when applying for disability pensions, carers pensions, and also looking at medical exemptions from mutual obligation activities, such as looking for work. I work closely with our Services Australia medical assessment team, local service centre managers and staff. I also provide support and assistance to representation from community and third-party organisation, which also includes and is not limited to New South Wales Health, the NDIS, Settlement Services International, STARTS, Allied Health, and a number of other community and third-party organisations. As I said to Ellen when she first sent this invitation over, I need to be very clear about the fact that the NDIS, or National Disability Insurance Scheme, it's a separate agency from Services Australia. I do work closely with representatives from the NDIS. However, it's important to note that the NDIS is a separate agency from Services Australia. I know this question does come up a lot at times, so I need to be very clear about this. So if you have any questions about the NDIS, I'm sure we can take those questions on notice and we can refer them on to representation from the NDIS. So a little bit about my work, or the Multicultural Service Officer Program. We work with community and third-party organisations, or CTPOs as we refer to them, and front-of-house service delivery staff to ensure our services are responsive to the needs of migrants, refugees and asylum seekers. We connect these communities to our information, payments and services. We promote and improve access to our payments and services, build relationships in community and across government, improve service delivery to culturally and linguistically diverse people by understanding their needs. We provide support and assistance in complex cases, including those medical scenarios that I mentioned in the opening summary, help our staff to communicate with CAL people through language services, build and maintain relationships with internal stakeholders to raise the profile of multicultural services. So how do I work and support organisations or allied health such as yourself, build and maintain strategic relationships with community organisations, actively participate in local local stakeholder meetings to understand the needs and challenges for CAL customers, gather feedback from community organisations to help improve our services to CAL's customers. We maintain strong connections to local organisations, including humanitarian settlement service providers, or locally, that is Settlement Services Internationals. We have very positive connections with TAFE, with the local TAFE and university, migrant resource centres and Workforce Australia providers, or the local job agencies. We attend and actively participate in various stakeholder meetings, such as interagencies and community forums. These meetings provide an opportunity to share information, discuss local community issues, and work collaboratively on solutions to improve outcomes for CAL people. So how we sort of individually work with customers. We deliver tailored information to the CAL community. We help customers with complex needs, and we support our refugee service offer. We play a very important role in educating and informing customers of their rights and obligations and helping them to navigate the system. We deliver information sessions to groups of CAL customers with the help of interpreters when required. We also promote digital services to CAL customers to encourage them to self-manage their business with us. MSOs are often the only point of contact for CAL customers with complex and multifaceted issues. We connect customers with appropriate services, liaise with other specialists, and escalate issues when necessary. So we provide a very strong and supportive interpreter service. We have face-to-face interpreters available during office hours, 5 days a week here in Armidale. These interpreters are fluent in Kurdish Kamachi, Arabic and English. We have information in more than 70 languages to help our customers understand our payments and services. You can read, listen, or to watch information in your language. You can go to the Services Australia website and in your language. So how to contact us? You can do that online, over the phone, or at a service centre or local Centrelink office or Service Australia office. You can do that in writing. Service Australia have a dedicated interpreter phone number. It's 131202 with representation for over 120 languages. So it's a massive call centre. Customers call this number and request an interpreter in their language. They'll be referred to an experienced staff member. So in summary, I'd like to hear from you today if you have any questions, particularly around the Centrelink Medicare program. As I say, my work is mainly working with CAL communities, but we have a number of other specialist officers from Services Australia that work with my aged care, community engagement officers, and so on. So, any questions that I can't answer, I can refer on to other specialist officers. I also regularly feed back to government as well too. It's important to note that around service delivery or how we can improve our service delivery to our customers as well as community and third-party organisations. So again, I'm more than happy to provide this feedback to government or the relevant staff members. So that's about it from me. Happy to take any of your questions on board.
Thank you, Matt. I definitely didn't know hardly any of that, so I'm glad that I was here to listen to it. As Matt was speaking, it did occur to me that I forgot to add something pretty important about TIS, and that's how to book an interpreter. So you can call the TIS hotline, ask for an interpreter on the spot. The speed with which you have access to that interpreter probably depends largely on the kind of language that you're requesting. If you're asking for someone who speaks Cantonese, you probably won't have too long of a wait because it's a very popular language. We have found with Kurdish Kurmanji that there's a pretty extensive wait and you're not always guaranteed to get someone. So while that may be a little bit tricky for when someone just fronts up to your practice and doesn't speak the same language as you, it's not something that I'd recommend doing for a pre-booked appointment. For a pre-booked appointment, you can book your interpreter online using the TIS website, and you can book them for a phone consultation where you just dial a number, they ring into your practice room, they're on speaker, and it's just a three-way conversation between you, yourself, practitioner, the patient, and the interpreter. You can actually book an interpreter for an on-site consultation. The on-site consultations go for a minimum of 3 hours, so you might actually find it pertinent to book in a couple of patients who speak the same language, so you can really make full use of that interpreter there as well. That's all I've got. Thank you.
Hi, me again. Just wanted to explain to people a little bit how the TIS for allied health came about. As you'll all be aware, specialists get TIS, GPs get TIS, the hospitals get TIS, real estate agents get TIS, but for some reason, allied health just did not have access to free TIS. That was really highlighted here, and I've got to pay tribute to one of my co-contributors, which was Tim from SSI, and there was a whole group of us, and we got together and really pushed with the government, met with the minister, etc., etc. So this now being just in resettlement areas, TIS has been allowed, and it's a 5-year pilot program. So basically my message to you all would be, if you don't use it, you'll lose it. So we really need people to start using TIS. We'd love you to work with refugees, but any multicultural people, every time you make a TIS appointment, it's all registered, all those numbers go to the Commonwealth, and they will be keeping a very close eye on what is happening here and how often it's being used. So please use it, that would be great. Okay, over to you, Sydney.
Thank you so much for all of that important information. No questions came in today, so we are going to end it here. Just a friendly reminder about the evaluation survey that will come to you after, and the recording will be up in a couple days. Thank you, Ellen, Kristen, and Matt.
Thank you.
Thank you.
Thank you.